Dr. Stephen Sinatra is one of the foremost experts in clinical cardiology. And what really makes Dr. Sinatra unique is that he has an appreciation of not just drug therapies in cardiology or surgical therapy, but also nutraceutical therapy.
Dr. Stephen Sinatra joins us. He is a world-renowned cardiologist. Not only does he know about medicines and surgery and this type of thing, he knows about natural treatments of the heart. And this is knowledge that's so valuable.
You know, people need conventional cardiology. I mean, some people need bypass and some people need angioplasty. I mean, I still believe in that, but you got to balance it out with the alternative cardiology, and I call it integrative cardiology, where it's the best of both worlds, because the conventional cardiologist today only treating half the person.
95% of pharmaceutical drugs cause nutrient depletion. So anybody taking pharmaceutical drugs needs nutraceutical support. So you really must take supplements if you're taking pharmaceutical drugs. Patients can be a doctor's best messenger. I mean, I've been practicing cardiology for 35 plus years, and my patients would come in with this idea or that idea, and I didn't say, well, throw it out, there's no research on it. I says, teach me, empower me, bring me some articles on it, bring me some literature. And the one thing about metabolic cardiology, there are thousands of articles on coenzyme Q10, the carnitines, magnesium, and ribose. I mean, we've been using magnesium since 1908 for the treatment of eclampsia and pregnancy. I mean, that's one of the most vital minerals we have to, we use in our armamentarium, and I'll tell you, it absolutely works.
I was taking care of a rabbi in the Connecticut area, and he had bypass surgery, an aneurysm, a pacemaker inserted, a defibrillator inserted, then he had to replace his aortic valve, and I was holding them together with glue for years. Drugs, I mean, you can imagine what I was doing. And I tried him on CoQ10, but he was a real small guy, about 90 pounds, and he couldn't take it because the CoQ10, his heart was so starving for it. When I gave him a pill, his heart would like jump a little bit. He had like a caffeine effect.
Oh my!
So guess how I had to treat him? I had to give him lox, Nova Scotia lox, every day to build up his CoQ10 levels.
I see, because the salmon had
CoQ10.
Had a small
I did this for 6
amount.
months,
You could do it.
and the cardiologist in Hartford is saying, "What are you doing for the rabbi?" And I said, "I'm treating him with lox."
Can
That's
you
what made
believe
the
it?
difference, because that small amount of CoQ10 got his heart to a certain level.
Well, I thank God that God has worked through you to bring relief to so many people.
That's right.
And doctor, one of those patients was me. I went through chemotherapy for Hodgkin's lymphoma, and one of the chemotherapy agents damaged my heart.
Adriamycin.
That's it. Shortness of breath, apprehension. I couldn't walk across the room without struggling. And your methods gave me the strength. The shortness of breath just went right away. I still have a heart condition, but I can live life again.
That's right.